Good evening, and thank you for joining us for today's Guide to Medicare and Golden Retirement event presented by Medical Mutual. We have an absolutely awesome program for you today. Speakers, guest speakers, panel discussions, live Q&A, and those Q&A sessions will happen after each panel. So make sure you get your questions either in the chat box or the Q&A box. If you do it in the chat box, make sure you pick all attendees and participants. Otherwise, I will be the only one seeing the questions and I'll get them to who they need to be. But if we could do that, it'll make everything go a little bit smoother. And do not be shy about asking those questions. You might even win a prize. Throughout the event, we are giving away signed copies of Terry Pluto's book to people in the chat, but this is not the only way you can be a winner. At the end of the program, we are giving away a $250 Amazon gift card. That winner will be drawn at random from everybody who is attending today. That means if you're dialed in, you have a chance to win. Now, before we jump into the program, a big thank you to our sponsor, Medical Mutual and the Ohio Department of Insurance. You can find out more on our partners in the chat and also our event website. And right now, a short message from Medical Mutual.
Okay, here we go.
That's my pops. He's big on adventure. Luckily, he has a Medicare Advantage plan from Medical Mutual. The added coverage means he can keep doing everything he loves with me.
Hey, popcorn?
We're talking $0 premiums and copays. Not to mention $0 prescription drug benefits and preventive dental care. I mean, come on.
Hey, get down here. Let's see if I can do a flip.
Medicare Advantage plans from Medical Mutual. Jump on board.
All right, friends, let's get this show on the road. I'm excited to be joined by my esteemed colleagues, Julie Washington and Terry Pluto, as our moderators for the entire event. Julie Washington has been a healthcare reporter for The Plain Dealer and Cleveland.com for 4 years. She joined the Cleveland.com team in 2020. During her career, she was the editor of Friday Magazine and Next, news exclusively for teens, and wrote about pop culture and home and garden. Terry is a columnist with Cleveland.com and The Plain Dealer. He's a Northeast Ohio native, having attended Benedictine High School and graduating from Cleveland State University with a degree in secondary education and social studies. You are no stranger to these two. So welcome, if you would, Julie and Terry. Friends, how are you?
We're great, and we're just so happy to be here. Thank you, Eric, and thanks to all of our panelists today. And, we've been chatting before this started. And, Terry, we were just saying how important it is to know this stuff, know what you're getting, know what you need. And it's so important to take charge of your own healthcare and just be in charge of it, be aware, and be educated. And that's what today is all about.
And we are also talking about, too, that a lot of people want you to get into their Medicare plans, and they come on TV, like former quarterbacks, like Joe Namath and Joe Montana I've seen, or J.J. Walker, and say, dial this 800 number, we'll take care of you. As somebody who is 66, I've been doing Medicare a little while now, that's not the best way to do it. And that's one of the things we want to kind of guard you against, is making a snap decision having to do with something as important as your health. And we got some people here that really could help give you advice, guidance, encouragement.
Yeah, there's so much bad information out there and people looking to take advantage of you. But today you're going to get the straight dope. You're going to get the truth. You're going to get your questions answered by experts. So that's what today is all about.
All right, friends, we'll get back to you guys in a second. And before we jump into that first session, we want to know from you, where are you on this journey? As Terry said, he's been doing this for a minute. Where are you? Are you eligible in the foreseeable future? Are you a seasoned pro? Are you a caregiver? Fill it out in the poll and let us know where you are on that journey. Okay, let's jump into our first session of the day, a conversation with Terry Koenig on what to take into consideration for the 2022 enrollment period. Terry Koenig is the Chief Medical Officer at Medical Mutual of Ohio. Dr. Koenig is a board-certified internal medicine with added qualifications in geriatric medicine. She is a fellow of the American College of Physicians and has advanced standing status with the American Association of Physician Leadership, and is a diplomat of the American Board of Quality Assurance and Utilization of Review Physicians. Now, welcome Dr. Terry Koenig and Julie Washington back to the stage. Ladies, the floor is yours.
Hi, Dr. Koenig. Thanks so much for being with us today. People often ask, if I'm looking for coverage beyond original Medicare, what are the most important things I should consider when researching and looking for the right Medicare plan for me?
Well, thanks, Julie, for having me today, and thanks, Eric, for that introduction. I've been telling my patients and our members since Medicare started in the late 90s, the first thing you want to ask yourself is, I need a plan for me. Is my doctor in it? Is my hospital in it? And that's something you really should check every year, because plans change of who is in their networks. So number one, I always say, is it my doctor? Is it my hospital system? Is it my specialists? So if you're someone who goes to specialists a lot because of a certain health issue, you have to see if they're in it too, not just your primary care. You want your primary care, but if you're a high utilizer, your specialist. The next thing you want to look at is, what's my financial situation? Am I someone who spends a lot of money that goes to a lot of, will have a lot of copays? So depending on where you are, you may want a Medicare Advantage plan that gives you zero copays, zero premium, zero specialists, and an out-of-pocket max, or you may want a Medicare supplement plan, which could be higher out of your pocket cost. The third thing you look at is your drugs. If you go to a Medicare Advantage plan, you get them all rolled up into one, A, B, C, and D. It reminds me of my kids were little with the Barney alphabet soup. If you're in a Medicare Advantage plans, they will have Part D prescription in it. And if you go that route, you could actually go online to medicare.gov and put in your meds and see what your medications will cost. If you do a Medicare supplement, you still have to have your Part D deductible as well as a Part D plan. So those are three things. And then the last thing you want to look at are what are the advantages of one plan over another? Medicare Advantage plans do a lot of care management. They help you get preventative screening. They're actually just been rated recently on how good they are, ranging from 0 to 5 stars. So you always want to look for 5 or 4.5 star plans. And what other benefits do I get? Medicare Advantage will give you some dental, preventative, hearing, silver sneakers. I know a lot of people out there are getting their health, taking it seriously and want to get into the gym. That's included in a lot of Medicare Advantage plans. So you want to look at that. New for 2022, previously, if you traveled and stayed somewhere for a long period of time, you only had emergency coverage. A lot of plans right now have travel benefits. It may be for certain types of situations or a dollar amount. So you really want to look at what fits you based on what you need, your health status, your physicians, your drugs, and the added benefits if you want them in a plan.
Okay, wow, that was a lot of information
Sorry.
there. No, that's fine, that's fine. Just to circle back though, maybe you could explain what a Medicare supplement is?
Sure. So there's different types of Medicare. Part A covers the hospital, and that you've had to work so many years and you get that. Part B, you actually have a premium for. Part B covers the outpatient, so your doctors, your outpatient testing, and that has a deductible. So that deductible is the gift that keeps on giving. You'll always have a 20% copay. So many people buy a supplemental plan to cover that 20% on Part B. You still have that initial deductible, but once that is met, your supplemental plan will cover the 20% of your Part B. Now, again, I always warn people, if you go into a supplemental, that's fine, but don't forget your Part D, because if you don't do it when you first sign up, you get a penalty later.
Okay, good to know. Many of us take medications or prescription drugs, and of course, those can be very costly. How can people make sure to get their prescriptions at the lowest price possible? And what should they consider when they're shopping for a plan? I think that would be Medicare D, correct?
Yes, it is. So there are standalone Medicare D that you would buy if you went the Med Sup route. or the traditional Medicare route, which is basically coverage, nothing additional than the A and the 80%. But really what you should look at, and you should always be asking your physician, is this drug available in a generic or a lower cost form? I can tell you, I now have adult children. I don't think they've ever had a brand name drug in their life because I would always opt for generics. That's your first step. Your second step is look at the plans you are considering and see if your drug is on their formulary and at what copay. Many plans have drugs that are zero copay, and those are really the ones that a plan who wants to keep you healthy will cover with no copay, such as hypertension or high lipids, something plans know that keeping you healthy is very important.
Okay. When you're looking at a network and you're looking for your doctors and hospitals, what's more important, to look at the network or to look at the covered hospitals and doctors? And how do you go about finding that out?
Again, I think both are important based on your health status. If you're a person that only sees a primary care a couple times a year, and whatever hospital you go to, you really don't care, you might say, as long as my doctor's there. If you're someone who says, I want Metro Health System or I want University, then I think you need to look if that facility and that system is in your network. That also goes for your specialist. Unfortunately, some people have some significant health burdens that they manage quite well, but need to see a specialist several times a year. So you look, as your specialist there, and then what does it cost me to see that specialist?
Right. So it's really a personal decision. You've got to
Yes.
weigh what's more important for you.
Yes.
Yeah. We just have a few minutes left. Can you tell us some other items or considerations that people should think about if they're looking to get a Medicare plan or change plans?
Well, I think you have to say, what do I need and want? Do I want the benefit of all the Advantage plans? The lower out of pocket, maybe no premium, a low maximum out of pocket? And is that financial outlay good based on my doctors and hospitals? And do I want the added benefits? Do I want the dental? Do I want the silver sneakers? Do I want transportation? Do I want a travel benefit? Now, if you want complete choice and don't have any concerns about costs, you may want to go the route of a Medicare supplement, which you would then have to buy for the wraparound for your Part B, and then also buy the Part D. And I'm seeing a lot of chats that I'll try to put in writing after we're done, Julie.
All right. So it sounds like anything else in life, the more you pay, the more benefits you're going to get.
Not necessarily.
No? Okay.
Right now, and I'm really trying to, I want people to look at all the plans out there. I believe ours are top notch. We were just awarded 5-star for our PPO, but there are Advantage plans out there that include our broad network. Broad physicians have maybe some limitation that you stay within our broad network, but have zero copay, zero premium, zero specialists. So I think it is something that people should look as much information as they can get, as you mentioned, take charge of their situation, sit down, discuss it with people who can give them facts, and use this information that the Plain Dealer and Cleveland.com are putting out there to make the best choice for them.
Right. Don't just believe a random Facebook ad, right?
Correct.
Okay.
Yes.
Thank you so much, Dr. Koenig. I'm going to turn it back over to Eric
Thank you.
for the rest of our program. Thank you.
Thank you so much, guys. What an awesome conversation. And right now, let's dive a little bit deeper and discuss how to choose the right plan for your needs and what coverage should you have. For that conversation, we have Christina Regg and Amanda McFarland joining us. Christina Regg is the director of the Ohio Senior Health Insurance Information Program, or OSHIP, at the Ohio Department of Insurance. Christina has been with OSHIP for over 23 years and has been the director since 2012, ensuring education, outreach are both delivered equally and equitably across our state. OSHIP's mission is to provide objective and unbiased information to the Ohio Medicare patients so they're able to make educated decisions regarding their Medicare health and drug coverage. Amanda McFarland is the account manager at Medical Mutual. She is the account manager for Northeast Ohio, supporting the Medicare and individual family markets. Amanda has been in the Medicare market for over 15 years. As I said before, make sure you get your questions either in the Q&A or in the chat. We'll bring Terry Pluto back. And my friends, the floor is yours.
All right, hopefully we get ready to go. Just a couple of things before I go to Christina and Amanda. I mentioned before about the ads on TV, these 800 numbers. I really can't underline that enough because I know somebody that got caught in that web and they ended up going, there's somebody in Texas, and it just, they have a template they kind of shove everybody into. So be really careful. And also this is, for a lot of us, this is, can be intimidating. I'm like you, I'm on Medicare. And so I've had to go do some shopping and do some work at it. And the great thing is when we do research like this and talk to some people, that the nice thing, especially with Christina and Amanda, I've talked to them both already, they actually speak English, not just Medicare. And that'll help get somebody along. So I'm going to start with Amanda. No, I'm going to say, Christina, let's go to you first. Why don't I just go do it on the website at medicare.gov and just kind of do it that way?
Well, a lot of Medicare patients are doing that, and that's wonderful, but there's a lot of information to glean from that website. However, if it starts to feel confusing or overwhelming, we do encourage folks, you're not alone. There's local assistance through your independent agents, through our program. We have counselors locally, we've got toll-free numbers, websites, and Medicare.gov and 800 Medicare. So I don't want people to feel they have to navigate all the different options. I believe it was Julie said it very well, that we want everyone to take charge of their own healthcare and be educated. There is no one size fits all. You need to determine what's important to you and find the health plan that fits your individual needs.
One thought too, and before I go to Amanda, is that I remember when I first started this, and I did look at the website. To me, and I'm somewhat computer savvy, I found it very confusing. So I ended up using an independent agent, but there's different ways you can go. But the big thing is, it's our health. And if we don't spend a lot of time doing the research on it with our health, well, then what is more important? And Amanda, in terms of that, how do you get people to say, all right, here's a couple things you need to know as you go into Medicare. And after all, it's only your health.
Mm-hmm. Yeah, I mean, I think to your guys' point, I think finding a local independent agent is the best way to go. But I think when it comes to Medicare, there are certain topics that are always most important to the members. It's who are my doctors and what medications am I taking? And then you start to dive into the benefits. So making sure every carrier has different networks. So making sure that your providers are in that network and making sure that your prescriptions are on each carrier's formularies. Just because it's covered by one doesn't mean that it's covered by another. So I think that those are typically two of the driving forces when selecting a plan. And then once you figure out those two, then you can start diving into the actual benefits and determining what you're going to pay for certain services.
Christina, if you were to warn people, besides, I did the thing on the 800 number on TV, but a couple other things where it's easy to fall, into this trap door.
Well, first and foremost, certainly don't give out any personal information to somebody that has reached out to you. Unfortunately, beyond just enrollment scams, there's a lot of fraudsters that target the Medicare population for identity theft. And we also would encourage individuals that have experienced that, please report it to us. We can't take action if it hasn't been reported. So if something sounds fishy or maybe too good to be true, it's worth giving us a call to see if we can look into that a little bit farther. But on kind of a broader note too, I would encourage folks that choosing to do nothing during Medicare open enrollment is also a choice. You're going to end up in the plans you're currently in unless those plans are going away. So if you choose to do nothing during this time frame from October 15th to December 7th, that's a choice, and we discourage that. This is the time. This is the time to dig deep into all those options and make an educated decision for next year.
Amanda, suppose I just turned 65 now and maybe I'm still working, but I go, I don't even want to deal with this Medicare stuff now. It seems too confusing. I'm just going to ignore the whole thing. What happens?
Yeah, so I mean, it honestly depends based off of the group that they're enrolled in. Groups with under 20 employees, that employee would want to enroll in Medicare because Medicare becomes their primary insurer. So if they don't, they're going to be on the hook for a lot of claims. But if the group is over 20, then they can definitely defer it until they're ready to retire. So it's really based off of your group size. And again, kind of your personal choice, but under 20, they would want to enroll in Medicare.
What if I say, okay, I'm not going to do it, and then like in January, now I want to get on Medicare?
So if
in other words, I've blown the time.
when you
What's the
first,
time frame again?
I'm sorry,
What's the time frame that you have to enroll?
from the time that you turn 65,
Yes.
you have 6 months from the time you turn, no, I'm sorry, I just went med sup. You have 3 months before you turn 65, the month of your 65th birthday, and 3 months after.
Okay.
Qualifying event. So if you were over 20 and you lost that employer coverage, that would give you a special enrollment period to enroll in Medicare at that time.
Christina, besides your doctor, your hospital, what else should I look for?
One thing I want to just piggyback on that is Amanda shared, there's a lot of enrollment periods. So, don't get tied up in wondering if you're in a position to make an enrollment, seek that help at that time too, so you don't miss very important dates. But yeah, coverage, cost, and convenience are the three things we stress for individuals to look for in their healthcare
Say it real
coverage.
slow again, Christina. What are the big three?
Coverage, cost, and convenience. So coverage, we've hit on that. Making sure that all your needs are covered by the plan, having the convenience to go to the doctors, hospitals, all practitioners that you want to utilize, and then finding the plan that provides that at the lowest cost out of your pocket.
One thing I would suggest too along those lines is, suppose if you have a lot of doctors and specialists and things, I would almost make a list of like, this is the most important one, this is the second one, this is the third one, the fourth one, because maybe you won't be able to get them all in, the best plan, but we have to know what we want. And Amanda, I know you talk to a lot of people who want to, they're looking at Medical Mutual and this. What do you find that, what do they want? And what do you want them to know? Like, what are common things that they want when they're looking for coverage?
As far as like what benefits are typically most?
Yeah, just, when they come in, here's what I'm thinking, Amanda.
Yeah, so I think if I'm thinking of a plan, when you think what benefits are a member going to utilize the most, chances are they're going to get their medications filled, they're going to go to their primary care, and they're going to go to their specialist. There's always, okay, you might have an x-ray, or you might have an inpatient hospital stay. But I think, what, if you've got 10 specialists and you go and see them once a year, and one carrier is charging you a $0 copay for that, and another carrier is charging you a $40 copay for that, that's a big difference. So I think kind of those benefits that mean the most. Now, listen, somebody might know that they're going to have an inpatient hospital stay next year, and that might be important to them. So yeah. And like Christina said, I really think that you need to look at plans every single year, because every carrier changes their plans every year. There are new options available every year. So just thinking that what you have now is okay, it's not necessarily the case.
One of the things I'm going to ask you this is that I work out a fair amount. And so we look for a plan with silver sneakers. That saved me and my wife approximately like $60 a month.
Oh yeah.
Depending upon what health club you're in, it could be more. So how many, Christina, are most of these plans interested in the silver sneakers thing? And can you explain how that works?
Sure. Those plans are typically associated with the Medicare Advantage plans, which are the alternatives to original Medicare, the supplement, and the D plans, and they're considered added benefits. So Medicare Advantage plans at minimum have to cover what original Medicare would pay for. However, they often add benefits to those packages. It's enticing to members to join, and it can include gym memberships. Silver sneakers is one of those examples. Vision, dental, hearing, transportation, cash money at local pharmacies. So these are all wonderful added benefits, but we still encourage folks to look deep at the health and the medical benefits before looking at those added benefits.
Do you have anything too, Amanda, along those lines, what we were just talking about?
Yeah, I mean, I think that she covered most of the added benefits. So the thing that I would say is Medicare Advantage, you have to cover the Medicare benefits, and then you can add additional. Medicare supplements are all standardized. They are the same with every carrier. You can't add benefits to Medicare supplements. The Medicare Advantage plans are where you would pick up those additional items. And you can't have both. You cannot purchase a Medicare Advantage and a Medicare supplement. So you can't say, well, I want this dental and vision over here, but I want the supplemental benefits over here. It's one or the other.
Christina, if you were told you had 1 minute to tell people, maybe looking at Medicare for the first time, you got on the clock, you got 1 minute. What would you tell them?
I tell them that's impossible.
Besides your big, well, say your big three, your 3 C's.
The coverage, the cost, the convenience of the plans. And I guess I'd use that one last minute to just highlight what Amanda shared, and that's knowing the difference between Medicare Advantage and Medicare Supplement. Probably the biggest misconception we hear is individuals think they have a supplement. We do a little digging, they're actually in an Advantage plan. So we don't want to use those terms interchangeably. They're vastly different. Supplement will pay after and only after Medicare Part A and Part B. The Advantage plan replaces the Medicare Part A, B, and the need for the supplement. And they usually have the Medicare drug benefit rolled into one. Kind of a bed in a bag, all your benefits in one product.
All right, we have questions. Maybe we'll throw this to Christina. There sounds like, since you're from the government, sort of.
The government, I'm here to help.
Oh, yeah. As long as we both have credible, in other words, I guess, good medical insurance, are there any penalties either now or when we do sign up for not having signed up for Medicare at this time?
Yeah, credible coverage typically is a term that relates to drug benefits. Is equal to or better than what Medicare is offering? If you have access to prescription drug coverage that is equal to or better, such as the VA, a group health plan, an employer plan, you can delay signing up for a Medicare Part D plan. And if you were to ever lose, heaven forbid, that drug benefit, you could sign up without penalty. That's often confused. There is a Part B penalty. If you are still working when you are turning 65 and you are covered by your employer's group health coverage or your spouse's group health coverage, you can delay taking Medicare Part B. Most sign up for A. You've paid for it all your working life. You're entitled to it. B is the portion.
A is basically hospitals and stuff like that.
A is your inpatient coverage at hospitals, skilled facilities, some home health care and hospice. B is your outpatient. You can hold off on taking Medicare Part B as long as you are working or covered by current group health coverage. When you, or if it's under the spouse, decides it's time to retire, quit, walk off that job, you will have a special enrollment that Amanda mentioned, 8 months from the time you leave that employer to pick up Medicare Part B without penalty. Be proactive.
One thing I wanted to stress too, Christina, and maybe Amanda, I could do this, is a lot of times we think we're pretty healthy, we're in pretty good shape, like my father did, and then he had a stroke. And suddenly we're into like long-term care situations, all that kind of stuff. How does Medicare work? Like somebody has a stroke or somebody has even like a hip replacement or that, where you end up, you can't just go straight home.
So as far as like medical underwriting, Medicare supplements are medically underwritten unless you take one when you initially qualify for Medicare. Medicare Advantage plans, they're not medically underwritten. So this annual enrollment period, anybody can come and enroll in a Medicare Advantage plan. The key with both of those plans, which we did not mention, is regardless of whether you do Advantage or you do supplement, you still have to have your Medicare Part A and B, and you're still paying for B regardless of Advantage or supplement. So no matter what, you're going to have that Part B premium. But as far as like somebody being able to say you're accepted or you're denied based off of the medical conditions, that would only come into play with a supplement, not an Advantage.
Okay. Whoever wants this gets to get their hand up real quick. Can you enroll in an Advantage plan in addition to a supplemental plan?
No.
No.
Well, I'll just say no.
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 How do I decide whether I want a supplemental or an Advantage?
I think, as we said, the Medicare Advantage, it replaces your Medicare. So whenever you go and you utilize services, you're gonna have copays every time that you use that Advantage plan, but generally zero premium or really low cost for the Medicare Advantage plans. A Medicare supplement, you're going to pay higher premiums, but it's going to supplement your Medicare. So claims will go to Medicare and then they'll go to the supplement. And really, I would say Plan G is probably one of the most common Medicare supplements. All that you have is your Part B deductible on that. But the catch is, again, it has to be a Medicare covered service in order for that supplement to pick it up. Whereas
I know of some people, this is, or maybe posting this for the first time, and their heads maybe ready to explode with B and Medigap and all this. I'll just say, this is somebody who's just walked down that road a couple times. Unless you have a really great health plan with your company, or like you're in the Congress or something like that, seriously, like that, odds are, if you do a little shopping and get somebody to guide you, you will find a better deal with Medicare and some of these other plans. So don't be intimidated by maybe some of the jargon or things going on here and say, well, I'll just stay where I am, because that may not be the wisest choice. Okay, Christina, can I switch back and forth between Advantage and traditional plans every year?
Yes. So during this open enrollment period, you're deciding if you want to be in a Medicare Advantage plan, go to a different Medicare Advantage plan, or go back to original Medicare. That can happen every year. As Amanda shared, though, when you go back to original Medicare, unless you're in some very specific guaranteed issue opportunities, you can apply with any company that sells at any time for a supplement, but they will go through medical underwriting. So you may or may not be issued that policy. Additionally, I think this was covered earlier, you also have to shop for that Part D plan. You would want to do the coverage comparison and find the most cost-effective prescription drug plan, so that I like to think of two options. So option one is going to be original Medicare, your red, white, and blue card. Card two in your wallet is your supplemental insurance to pick up what A and B doesn't cover. And then the third card in your wallet would be prescription drug coverage. That's one option. Option two is joining the Medicare Advantage plan, generally having that one card to cover your A, your B, and your prescription drug benefits and any added.
That would be like like Amanda's, that would be the kind of thing that like Medical Mutual would do, or some of these others. Is that correct?
I'm glad. Yeah. When you say those large companies, you have to realize Med Mutual has supplements. They have drug plans. They have Advantage plans. So it's knowing which option that you want to be part of, and then investigating all those individual plans from there.
Amanda, suppose, for example, if Cleveland Clinic is in your network, will all the doctors all the Cleveland Clinic doctors, are they also in the network?
Yeah, so I mean, the way that our contract would work would be, as long as they were employees of the hospital that was in network, then yes, they would be in network, yes.
Okay, how can I be sure that an advisor is independent? I'm going to go that, Christina, since you're the government and you're here to help. And actually, there's a line that has some negative connotations to it. In some cases, that's correct. But in this case, no, we need some guidance from on top. So I'm going to, they talk about I have an independent agent. Her name is Becky. She has shopped different companies for me, and I have her do it every year, because just because last year it worked doesn't mean it's going to be my wife has an allergist and that kind of stuff that it'll be in it this year. So anyway, back to Christina. How can I be sure that the independent advisor is indeed an independent advisor?
You can actually use our website, insurance.ohio.gov, and you can look up your agents on that website. If you're unable to find or locate that tool, just give us a phone call and we can assist you with that.
Maybe you could, what would you Google? Suppose that might be, because it's kind of hard to, so you would say, what, best independent agents, or what do it again, Christine.
You know, I love Google, but this might be one I would pass because
Yes.
I don't know what you're going to pull up if you Google your independent agent.
Right.
You're probably going to get right back to that broker in Texas. So go to the insurance.ohio.gov, G-O-V. That's the key. It's a government website. And all of the agents that are licensed through our department would be in that database.
Okay, Amanda, can you please explain? I always get a little worried when questions start that way. This one, actually, I think there's not a smoking gun behind it. Can you please explain type 1 medications versus prescriptions?
I don't understand that question.
Or type 1 medications and prescriptions. Is there a difference or not? See, I don't either.
So I'm wondering if maybe they're referring to like Part B medications versus Part D, like B like boy, D like dog. That's the only thing that I can think that they're discussing, or maybe like the different tiers of medications.
Yeah, see, I didn't know. Christina, do you have a clue on this?
My mind jumped to tiers, and on all Part D
Maybe that's
plans,
a
whether
good answer too.
they are the standalone prescription drug plans or if it's part of a Medicare Advantage plan, it's covered under the formulary, but then those medications are tiered. So tier 1 might be preferred generics, and those might have a very low or no copay. Tier 2 could be preferred brand. Tier 3 could be non-preferred brand, and you could get into specialty tiers. So generally the copay increases the higher the tier. And that's something you want to review. You know, maybe you had a tier 1 medication in 2021. It may not necessarily be tier 1 for 2022.
Amanda, have you recently seen somebody who besides the 800 on TV number, but made a really big mistake in Medicare in the past, and you would like to say, don't do that?
Yeah, I mean, I think so. I actually work with the independent agents, so I don't deal directly with members. So I definitely have stories from my agents where they call me and somebody has been switched unknowingly, not necessarily realizing what they sign up for.
Wait a minute, how does that happen?
Huh?
How does that happen? What do you mean switched unknowingly?
That's a good question. I'm not really sure. But like Christina said, I would definitely, in those situations where members are skewed the wrong way, make sure that you reach out and let them know that has happened. But
let's ask Christina. Sorry, Amanda. Maybe do you have a clue what are they when Amanda says switch plans unknowingly?
Unfortunately, there's a lot of unscrupulous activity that goes on. For example, if an individual is low income, they have a little bit more leniency in enrolling quarterly into plans. Oftentimes, unscrupulous agents and broker firms target those low income individuals so they can gear them to a different plan throughout the year and simply to collect the commission. We have had cases that have come through our office that an agent uses a special enrollment period that doesn't even apply to the individual to make that sale mid-year. And I think that's important to know as well. You know, I'm sure Amanda will share her agents, OSHIP, we're not just here during open enrollment. We're available 365 days a year. If you have issues utilizing your plan or you have casework that needs to be done, we can assist. And I know at OSHIP, we will file your complaint directly into Medicare's complaint tracking module so that the state has eyes on it, the federal government has eyes on it, and the plan has eyes on it.
Okay, here's one. I think it says, what is Plan C?
Okay, that's Medicare Advantage. All these letters, A, B, C, D, E, F, G.
Okay, there you go.
Medicare Part C is just the Medicare Advantage plans that we were talking about. So it is your Part A and Part B that's administered by a carrier instead of Medicare. And then typically you have the D in there as well. But the C is just really A and B benefits from a carrier, Medicare Advantage.
I'm not sure how much this has to do with Medicare, but it's a decent question. And somebody said, is COBRA insurance credible insurance? And does it have anything to do with this?
Go ahead, Christina.
Okay, a little bit. So if someone is laid off from their employer, they have the option to extend their health insurance through COBRA. It's a law. You pay the full amount plus a little administrative cost to keep your employer coverage. The key thing to know about COBRA and Medicare is COBRA is not current group health coverage. So if someone were to not enroll into Medicare Part B because they had COBRA, they would face a penalty later when they enroll. And the Part B penalty is 10% for every year of delay.
Generally, you're better off when this Medicare thing rolls around is getting into Medicare. Again, general statements always have exceptions.
I think with COBRA, yeah, because COBRA premiums are typically high. I think unfortunately people just don't realize that there's other options out there. You know, you've got this package in front of you, so they elect that. So you do have to elect. COBRA is kind of weird because you have to elect the Part B because it's not credible for Medicare. But if you exhaust COBRA and you elected your Part B, you could at that point in time elect an Advantage or a supplement plan. So it's really that Medicare piece where it's not deemed credible.
Yeah.
And I would caution folks that are still working, not on COBRA, those benefits can be very robust. So you would really want to do homework, because if you leave an employer plan, in some cases, you're unable to get it back, typically if that's a retirement situation. So, you know, you'd want to look long and hard with your employer plan, talk to your benefits administrator before leaving those policies.
Okay, this is right.
I mean, I just got an email where their medication's covered on their employer plan, but not on any of the Part D plans. So
this is a question along those lines. Person said, I'm going to retire basically at the end of this year, on the last day of 21. Can I sign up to have Part B as of January 1st and add more later? Or do I need to decide all this at once?
Ideally, decide all this at once. It's coming up quick, and we've got a lot of overlapping enrollment periods. So yes, you'd want to contact Social Security. You can log on to Social Security or SSA.gov. Again, the GOV is very important to enroll into your Medicare benefits. Social Security offices are not open at this time to do in-person appointments. Online is the easiest route, or contact Social Security via their toll-free line. Then your Medicare is in place. And I guess I'm making an assumption that Part A is already in existence. If you haven't picked up A, you need both A and B. And then now's the time. Do your homework, investigate the supplement Part D option, investigate all the Advantage plan options, because if you wanted to elect an Advantage plan starting January 1st, you could do so as well.
Okay, here's a pretty good one, because a lot of people in this situation, actually even like in my age group where they're getting Medicare, but they're actually caregivers for someone who's older yet. And so the question is, are there any free services for caregivers to receive individual help or direction on how to navigate Medicare or Medicaid, you know, that kind of thing. So how about for caregivers, whoever wants it?
I think I'll speak, and maybe I'm jumping the gun to a later segment, but there's area agencies on aging that provide a vast amount of community services, and they could speak more directly to services provided for caregivers. Additionally, you know, a little bit along those same lines, there are assistance programs out there. You know, if you're caring for an individual and they are struggling to pay the out-of-pocket cost for Medicare, regardless of which option they've selected, there are Medicare savings programs through the Job and Family Service Office that can help pay all the out-of-pocket costs against Medicare.
Last question along those lines too, because it does follow up. If a person is on Medicaid, and they turn 65, do they need to get Medicare?
There's no law that states you have to take Medicare. Generally speaking, you're going to have more options if you elect to go that route. And there's also a Medicare, Medicaid duals demonstration in this area that has specific managed care plans that offer benefits targeted to the low-income population.
Plus,
All right,
depending
Amanda.
on their income, they might get the cost of their Part B covered too. So if they're hesitant of, I can't afford that Part B premium, there's help paying for your Part B premiums, paying for your prescription drugs. So they just have to know where to apply for that. But yeah.
All right, Amanda, you get the final word. They're waving at me. This is the last play of the game. The ball is in your hands, Amanda.
Okay.
Medicare, what do you want people to know?
Again, reach out to an independent agent. I mean, they're there, they can help you with every carrier and really navigating. And I would go into that appointment knowing your providers and what medications and what services are most important to you. And they
Christina, give us the 3 C's. That's how we're going to end it. Because I like that.
Coverage, cost, convenience.
That's right. Because that really will help you. And then I think my idea of putting your priorities, what you want. Like, for example, for me, silver sneakers would be higher than a couple of other things. So look at them all. A big thing I just would kind of close with is really know what you want. Because a lot of times people, I just want Medicare. As you know, that your head will just turn around sideways and, people have to call in for an exorcist on that. No, you need really to know what you want. And I'm going to hand this off to Eric because I could tell he is ready to come on the
Thank you, Terry. That was awesome, ladies. Thank you so much. Next up, let's talk about the more intricate parts of Medicare and what should you consider when transitioning plans? How do Medicare and Medicaid play together? And to give us those answers and many more, we have Jennifer Dietrich Myers and Craig Thomas joining us. Jennifer Dietrich Myers is the Medical Mutual Account Manager for Southwest Ohio, supporting the Medicare and individual family markets. And Craig Thomas is the Senior Director of Clinical Services at Western Reserve Area Agency on Aging. As the Director of the Clinical Services, he oversees the dual eligible Medicare and Medicaid population programs, assuring access to needed services and supports, and overseeing community care management of Medicare recipients to assist them navigating the complex, it's complex to say it, care needs. Again, all the questions in the Q&A box or the chat. Julie, welcome back. Craig, Jennifer, welcome to the show.
Thank you.
Hi, Eric. Hi, Craig. Hi, Jennifer. I just want to say I feel so much smarter now after listening to that terrific section that Terry Pluto led. I also want to tell everyone who's watching and listening in that a lot of those websites that were mentioned in the last section, they're putting the actual website, letters or whatever in the chat. So you can go to the chat and see the website links that they were talking about, if that helps you out. So Jennifer and Craig, I feel like so much was covered, but there's still more to cover. And I want to start off with just a really basic question. What is the difference between Medicaid and Medicare? And can you have both? So Jennifer, why don't you start?
Okay, I'll touch on Medicare. So with Medicare, that is a federal program, and you would need to be 65 years of age or older, or under 65 and disabled in order to qualify for Medicare. And it's important to remember with the Medicare piece is that income is not an issue in determining whether or not you're eligible for Medicare, where Craig will touch a little bit on the Medicaid and where that's a different scenario with that.
Craig?
Yeah, good afternoon, everybody. Yeah, and so not to make things more complicated, but to go from the Medicare to Medicaid, while Medicare is our national health insurance, Medicaid is based within our state. And so each of the states has its own Medicaid program. And the eligibility for that is an income-based eligibility. And it's also based on individuals with reduced income, individuals with disabilities. So they can enter into the Medicaid program, and then they may age into Medicare or receive Social Security disability and qualify for Medicare. And they become, as mentioned, dual eligible. So they're having both benefits at the same time. When they are dual eligible, Medicare becomes that primary insurance, and Medicaid is that secondary insurance. So they have full coverage. Medicaid covers, it's a health insurance program is where it's similar to Medicare, but it also covers vision, dental. You can also qualify for, Terry was mentioning about caregiver support and individuals with complex needs in the home. Under that Medicaid, you can qualify for home health care aspects and long-term services in the individual's home. And so with the dual eligible programs, as mentioned, Ohio is one of we have a demonstration program called My Care Ohio, where dual eligible members can receive a really great care coordination and care management in the community, helping them navigate. And people really do need help navigating both Medicare and Medicaid together and navigating their healthcare needs.
Yeah. So do you recommend that people sign up for both if they're eligible for both?
Yes, I think so. And because as mentioned, even though Medicaid is income-based and there is a cost for those Medicare premiums that does kick in, there's programs that are there to help pay for those Medicare premiums so that there's really no reduction or change in income, and you can just have an enhanced benefit.
Wow. Okay. That's a great benefit. Are there any changes to the Medicare or Medicaid rules this year? We're always hearing that the rules are changing. Are there any changes that we need to be aware of this year?
Yeah, and I'll talk about Medicaid first. Medicaid is a program that's really comprised of nothing but rules. So the rules can change really any time, depending on what's sort of going on. You may have heard, about Medicaid expansion as a term that's been brought around a lot. And that's where the state was actually changing some of the eligibility criteria to bring people into the program. We want to have as many people covered as possible, so that expansion allows that. Recently with the COVID pandemic, some of the eligibility criteria had changed to allow people to stay on Medicaid because it was harder to complete their re-eligibility and determinations for that. So the rules have broadened for that. I would say for Medicare, one of the, not so much a rule change, but as heard earlier, a lot of the formularies change, a lot of what's covered changes per year. So I think that's the flux that happens in Medicare. I think one of the things that we've really seen lately is sort of the real growth of telehealth and e-health, where people can access that Medicare benefit through remotely. And I think that's something that is going to just become more and more sort of embedded in both Medicare and Medicaid programs and healthcare overall.
Yeah. Jennifer, how can people find out about these rule changes or whatever else you want to add on this topic?
So what I wanted to add on from the Medicare perspective, I think one thing that you can always count on with Medicare is that each year, that Medicare Part B premium that Christina and Amanda were talking about, that does change annually. So it's important for individuals to know that if they are not getting any type of assistance through Medicaid to help cover some of the costs of that Part B premium, that they can anticipate there is going to be a change there. So that is evaluated. We don't have the final decision on what that's going to be for 2022, but we're estimating that it's probably going to go up about $10. That tends to be the trend. So that is, while it's not a rule change, it is something you can expect to change year over year. And also, as Craig had mentioned, you have it's a world that is ever changing. It's changing providers, it's changing formularies, it's changing benefits. And just to tag on to the telemedicine benefits, that has just been such an enormous change over this last year and a half, where it's really opened up that world for people to get in touch with their providers while not having to leave the confines of home. So it really has kind of taken us to a different level of care that, it is much more accessible for a lot of individuals if they have the availability of getting on the internet or using a phone to connect with their provider. It's just become a fantastic service. And I think it's one of those things that as we've moved into that portion of benefits and that portion of the world, I don't see that being undone. I see us continuing on that route more so.
Yeah, I guess that would be one good thing to come out of the pandemic. And you did a great job of explaining what telemedicine is. It's when you're on the phone with your doctor, you're on a video chat, Zoom, something like that, but it's secure. They're using a secure version of Zoom, and you're able to talk to him or her and even get prescription advice, whatever you need.
Yeah, it's become just a fantastic, really, truly a service for people. definitely.
Right. Now, if let's say I have Medicaid or Medicaid care and I'm happy with my plan, open enrollment's coming up. Do you really recommend that I change plans or I look at everything, or can I just keep my plan if I'm happy with it? Craig, why don't you take this one?
Yeah, and I know we heard about the C's earlier, and I think, we just want people to be wise consumers. The same way if you were purchasing a car, we've always heard about sort of Cadillac health plans, but let's look at it that way. You walk on and you want to look at what's the cost? What is the cost to me for purchasing this? We have the Medicare premiums, but possibly out of pocket expenses. Is it going to fit into your budget? What is the quality of this, what I'm purchasing? The STARS measures, is it going to be the same doctors? Is it going to be the same quality of care? And then the location. Medicare is it's a national program. So some people, we're approaching winter. It seems quicker and quicker every day. Some people may wait, the snowbirds that go to Florida or Texas or Arizona, they may want their Medicare to travel with them for those trips and, making a decision like that. So is it going to fix them to a specific state or location? So, the cost, the quality, and the location are those things. We want people to make an informed decision, and an informed decision for what is your actual health state now as you begin to look. Do you feel in good health? Are there areas or conditions that you really want to manage more closely and have, closer specialists and network providers in there? So looking at your health as it is right now, also knowing that it can always change, but so you're picking a plan that's going to be tailored towards what you can actually, get medically covered and approved.
All right. Well, I've got some questions here and time is running down, so I want to jump, but Jennifer, we'll give you the first question.
Sure.
Have we been given accurate information that once we sign up for Medicare, we can no longer make contributions to our HSA? And maybe you could start off by explaining what an HSA is.
Okay, so an HSA is a health savings account, and that is where you can put monies into an account that is, those dollars are tax-free. So it's a pre-tax contribution you're making to this account, but they are correct in that once you become Medicare eligible, you're signed up for parts A and B, you can no longer contribute to your HSA account. Now on the back end, you can use those funds for some medical expenses and other expenses. I would definitely encourage you to research those because there are things they can't be used for, but they are correct in the question that they brought up that once they are on Medicare A and B, they cannot contribute any future contributions to that account.
Okay, so you can't contribute, but you can spend down what's in there.
Correct.
Okay,
So,
great.
And do you mind if I kind of tag on to your prior question really quickly?
Sure.
Because I think Craig did a fantastic job of just saying, there's so many things to take into consideration each year. If you're on a plan, the one thing that are your needs change. So that change in needs can be, maybe it's a health condition that's changed that now you're needing to see providers more frequently. So it's important from a cost perspective as well as an access perspective to say, if I see a specialist one time a year, and now I know I've had this change and I'm going to see them 4 or 5 times a year, that's going to change your cost. So it's important to look at what are your copays and do you need to look at other plan options that are out there that could save you or be a lesser copay that in the long run could save you. It can be that you're going to be placed on medications or you have been placed on medications that you want to evaluate that cost every year because that changes. So the drugs that are on a formulary, which is a list of medications that a plan covers, that is ever changing. So it's important to take all of those things into consideration and do your homework every single year.
Right. That's so important. Okay, this next question we'll put to Craig. I currently receive Social Security widow's benefits and was told that I will automatically be enrolled in Medicare. Is this true? Will I receive a letter that prompts me to do so?
Yeah, and I'm hesitant to speak case specific, not knowing the things, but she will. She mentioned about getting letters. Everyone is going to receive, CMS guides, Medicare guides, information that should prompt them to where they are sort of on the trajectory for enrollment. So I would say check your mail and make sure, and reach out as to some of the resources that were mentioned earlier, 1-800-Medicare, to the Social Security office to confirm where she is, because it could be a case where she is on that enrollment. I just want to say something else to the letters and mailings. People often complain, I'm getting too much mail from my insurance company. I'm enrolled in Medicare and I'm getting letters and letters every day. I would say to people, use those letters as sort of a map of what your care is. Those explanations of benefits, explanations of coverage, they can be very valuable to you as you start maybe get a bill later and you want to track down what was covered. And especially for caregivers too, that was mentioned earlier, people that care for their parents that are on Medicare or have complex needs, all those things that come in the mail, ask them to stack them up so they can look through those at a later time, because that can sort of give a roadmap to what their coverage and care is. So I just want to say that the mail and that aspect, it's an important part of tracking your enrollment.
Yeah, good to file that away, right? Okay, here's our next one for Jennifer. I see that my state retirement system, SERS, S-E-R-S in Ohio, has a program. Is there any advantage to selecting a state program versus any other?
Well, I think you need to evaluate the benefits all the way around. You need to check and make sure that if you make any change to move away from your plan that you have, your state plan, the OPERS, the STRS, whatever it may be, it's important to know whether or not you have the option of ever going back to that. So this is a part where it's very important to speak with the benefit consultants that you have access to through SERS or STRS or OPERS. And also if you're working with an agent, I can't stress enough that you need to reach out to someone and make sure that whatever type of move that you make is the best move for you. If you are on benefits that are very comprehensive through a retirement program, you need to be cautious about moving away from that if you're not ever able to go back to it. So that's important. But as Craig said, there's so much to take into consideration. You get mounds and mounds of information throughout the year, especially at this time of year. And it's important to reach out with questions. Either you contact the 1-800-Medicare. If you are working with an agent, people will bring in stacks of information and ask them to help them sort through this. So it is important to make sure you're not just throwing everything away, because there can be some very valuable information in there from either a Medicare or a Medicaid perspective.
Okay, great. That's very valuable information as well. Okay, next question for Craig. If you travel a lot, which plan is best, Medicare or Medicare Advantage?
And again, this is sort of case specific. As I mentioned, Medicare is a national program, so you could be going into any 50 states and with your traditional Medicare and getting coverage there. That being said, if it's sort of, they know that they're going to spend 4 months in Florida where there's a hospital system that also has a hospital system here in our city, that they may be able to just, confirm that coverage is there. So it's, in general, it would say, traditional Medicare is the one that's going to be more fluid, especially if you're hopping in an RV at retirement and you plan to crisscross the country. Traditional Medicare would likely be your most safe bet to access care everywhere. But there's all sorts of variation in what Medicare Advantage plans are and how broad their networks are too, that it could be a fit either way. And again, it just speaks to the importance of doing that shopping and the research and confirming who's all in the network.
Okay, Jennifer, did you want to add to that real quickly?
I do, if you don't mind. So this is kind of going back to the conversation that Dr. Koenig had started, where you're looking at it saying, what is the right fit for my needs? Is it a Medicare Advantage plan, which is going to have a network associated with it, you have to stay within the confines of the network on a Medicare Advantage plan. But a lot of Medicare Advantage plans offer travel benefits that you can utilize when you are away for a couple months, whether you're going to Florida or Arizona, you can utilize some of those benefits for your non-urgent or emergent services. So that is a benefit that many plans do have. So it's important to look for that. But if you are someone that says, I want that flexibility, I want to go where I want to go, when I want to do that, and I want to know I have access to any Medicare provider. Those are individuals that would want to look more at the option of doing a Medicare supplement plan, which supplements original Medicare, because as long as they're seeing a provider that accepts Medicare, they can see anyone. So it's really looking, again, it's needs-based. Do you plan on doing a tremendous amount of traveling? If so, a supplement plan may be a great fit for you, but also don't rule out the fact that there are many Medicare Advantage plans that do have a travel benefit associated with them as well.
So like we've been saying all afternoon, do your homework, find out what's best for you, what works best for you.
Yeah.
All right. Okay, Craig, next question. This one's a little specific, but we'll throw it out there anyway. My carrier denied my coverage for a stroke I suffered in late August because the only symptom I had was loss of speech rather than other physical symptoms. What are my options?
Yeah, and again, that's not knowing sort of what the coverage is specifically, if it's, what their actual plan was. I think if it's something that, it was a claim that was submitted and wasn't covered, or additional, prior authorization requirement, to start off with their plan and who their carrier was. There's all sorts of appeals processes and grievance processes within any insurance benefit under Medicare, Medicaid. So make sure that they avail themselves and utilize that at all time. There's so many resources and advocacy agencies. I'm with the Area Agency on Aging, but there's countless advocacy, patient advocates, hospital advocates that could also help them escalate things if they think that coverage wasn't properly administered or covered.
Right. How do you find out about how to file a grievance? And maybe you should give a plug for your agency, because you have people who can help people with that sort of thing, right?
Yes, I'm with the Western Reserve Area Agency on Aging. So we cover the 5 counties in Northeast Ohio, but there's 12 other area agencies on aging across the state that cover all 88 counties. So there's coverage everywhere there. So they could, reach out to us through we have a no wrong door. Any call that comes in, we will make sure if we can't address it, that we will get them to the right place. As far as the finding the grievance and information, this goes back to those letters that we were talking about that get mailed out. Pretty much in that summary, there should be information on how to file an appeal and what to look through for recourse if they think the plan wasn't being administered correctly.
All right, great. Jennifer, next one is for you.
Okay.
I'm worried that an agent will push me towards an insurance that pays the most. I think they mean insurance that's the most expensive for them. Are agents' commissions fixed regardless of insurance company, or can they vary? So I think the person's worried that an agent is going to push them towards an insurance plan that's going to be expensive to get a commission. Is that the way it works?
So looking at your Medicare Advantage plans, whatever an agent is compensated for Medicare Advantage plans, that's predetermined, and it's set regardless of what plan they choose.
Mm-hmm.
So, I truly don't run across this where individuals feel coerced into something that they didn't want, that may result in a greater cost for, or a greater payment for an agent, because I truly do believe that the individuals out there are working on the behalf of a individual that's wanting to enroll, helping them to find a plan that's a good fit for them. But having said that, I think it's very important to also remember to be extra cautious and alert that, when you're getting a lot of phone calls, which are gonna happen when you're getting a lot of mailers, by all means, if you have any questions, if something doesn't seem right, you definitely want to reach out and ask, is this legitimate? I'm concerned. Someone's asking for my Social Security number, my Medicare number over the phone. That doesn't feel right. But I would say that in 99% of the cases, working with an independent agent that you can, even walk into an office or speak with them multiple times on the phone, and you have the ability to call them back, is very important as well. That they're working on your behalf, but you shouldn't feel pushed into something. It should be something that you're doing your homework, what your needs are, and you're looking for counsel. So I think that's important to keep that in mind, to never make a choice feeling like you're pushed into something.
Right. Craig, one of our viewers would like to know, could we get more information on drug cost gap? And maybe you should start off by telling us what the drug cost gap is.
Yeah, and so the drug cost gap, and I assume they're referring what's commonly referred to as the donut hole, where there's a certain amount of coverage that's covered under that Medicare Part B plan, and when you enter into a certain aspect of out-of-pocket costs, it's no longer covered. And there's a lot of variation between each plan on what's covered up to what amount, and as Dr. Koenig mentioned, each formulary is different. One thing that I would say about that, and something that we often do, is outside, when there's a huge Medicare Part B cost. And I remember back to early days of social work where before Medicare Part B, it wouldn't be uncommon to walk with someone up to a pharmacy counter and they would hand over a prescription, and it would be $300 for one prescription and there was no coverage. Now there is all, your Medicare Part D, and there are patient assistance programs that are available through pretty much every pharmacy. So if there is a medication that has a very high cost, each pharmaceutical network has patient assistance programs that are available, and we frequently enroll and refer people to these. So even if they are within that donut hole where they could have an incurred cost, there are assistance programs where they can meet criteria so that there is no coverage for those medications. Now it's based on exactly what the enrollment is, but we commonly help that. Again, patient advocates, doctors' offices, hospital, and pharmacies directly can help you link to those patient assistance programs for people that fall into that donut hole when it exists.
Okay, wonderful. This is our last question, but I'll let both of you have a chance to answer, but we'll start with Jennifer. Can you discuss the difference in cost for hospital stays through a Medicare Advantage plan versus Medicare with supplement? Jennifer?
Okay, so typically what you're going to see when you are on a supplement plan. So with a supplement plan, and I believe this was Amanda that had mentioned this, that the claim comes in, it goes through Medicare first. Medicare does their payment because they have to check and make sure it is a Medicare approved service. Then it comes through to the company that you have your supplement through. So depending upon what type of supplement you've chosen, there are plans out there that if it is a hospital stay, that you may not be paying anything on that. That supplement may pick up that full amount. So it's really looking at what type of plan you're choosing. If it's a Medicare Advantage plan, what you're typically going to see with Medicare Advantage is you're going to see set copays for set number of days per admission. So it's really looking at it and saying, okay, are my needs changing that I know I'm going to have a hospitalization coming up? That may be something that you definitely want to make one of your top 3 items that you're checking when you're looking at different plans. Does this company, do I have to pay a copay for the first 6 days, or is it the first 4 days or 5 days? And what is that amount? So it's a little bit different on Medicare Advantage versus the Medicare supplement, depending upon what type of supplement you choose.
All right, excellent. Craig, do you want to add anything to that?
Just to add sort of from a social service perspective, if people do incur very large hospitalization costs and it seems beyond their means, hospitals do have patient assistance programs, financial assistance support to see if they do qualify. We're blessed in our region with so many different hospital networks and systems and just lots of resources too. So we don't want people to ever feel that they're without resources or without support, because just from seeing from the panel today, we have so much knowledge and so much shared information. So check with their hospitals, reach out to an area agency on aging, your county department on aging, your city department on aging, and hopefully we can provide support to everybody.
All right. Well, this has been a terrific session, and I know we all feel a lot more confident and a lot smarter about our choices that are out there. Thanks, Jennifer and Craig, to you. And now Eric is back to lead us on in our session.
Thank you, my friends. That was amazing. And as always, if you guys have questions, make sure you keep them going in the chat or the Q&A. And I absolutely cannot wait for our next guest. I am honored to welcome a man who doesn't need an introduction, but we're going to do one anyway. He's a veteran of 50 years in Cleveland broadcasting. He's been a reporter, an NBC News correspondent, an anchorman at Channel 3, news director at Channel 8, president and general manager at Channel 8. He's a member of 5 Broadcast Hall of Fame. Please enjoy this interview with Virgil Dominic.
Hey, Virgil, did you ever think one day you'd be doing Zoom calls and interviews about on a Medicare webinar?
I never could imagine anything like Zoom.
Yeah, Zoom.
Wonderful.
And all those things with computers and that. I just wondered at the age of, well, 86, is that correct?
That's right.
What do you think when you hear that number?
When I hear that number,
Yeah.
I just think, I don't think about it too often. I still think I'm 46.
Mm-hmm. And go on a little more on that.
Well, I'm so fortunate. I'm slowing down a little bit physically, but thank goodness my mind still is operating, I think, fairly well. So I get to do a lot of things. I do a lot of writing. I write for a website. I do a lot of coaching of people across the country who are still in television. I get to, talk with them often and not only help them with their professional problems, but they call me and tell me they're getting married. Then they call and tell me when they're having children. So,
And
I'm
probably
still
when they're
involved.
getting divorced and everything else like that too.
Well, fortunately, there's not been, too much of that. And most of it is very, very happy. And gosh, I just am so thrilled to still be involved and still feel useful a bit, Terry.
How do you avoid it, whether it's in your profession or any profession where you did it for a long time, and maybe whether you're semi-retired, not thinking, boy, it was so much better in the old days, and kind of avoiding being that grumpy old person?
Well, I think I really was so fortunate. I do believe I was involved in the golden era of broadcasting when journalism and television was much like newspapers. It was very serious business. And of course, it's all changed now because of economic factors and everything. But I just have accepted that. I feel a great deal of gratitude that I was able to participate when journalism and television was an extremely serious business. When you had to check out sources before you put anything on the air, and I learned a lot from that. And I was so fortunate to be able to be an NBC News correspondent. I not only got to anchor at TV3 here in Cleveland, but I was an NBC News correspondent. So I got to be the substitute newscaster on the Today Show and work with people like Barbara Walters. I did a national radio show every day, Monday through Friday, NBC Radio News on the Hour. And so I just, I'm just extremely grateful for that. And then I look at the current state of television, in which I still have a number of really good friends, and I think they're trying, really, really hard, and they're still very, very professional. It's just that the economics of the game have changed so much. Terry, it used to be we had a serious story, we could work on it 3 or 4 days before we put it on the air. And today, I think, most of the reporters, they have to produce something today. So they don't
pretty
have
much everything, whether it's whatever news is, it is, microwave isn't quick enough. And so
yeah,
you're into that.
So,
an interesting thing that when I was looking at your biography, I assumed that you had grown up in Cleveland, but you did not. Where did you grow up?
well, I've always had a lot of relatives in Cleveland. When my dad came over from Italy, he got a job at the Goodyear Tire and Rubber Company in Akron. And then he got laid off during the Depression. So he migrated down to Oklahoma and worked in the coal mines all during the Depression. And so when the Depression ended, by that time he had met and married my mother. So I got, I got born in Oklahoma. But then after college and 3 years in the Air Force, a wonderful time again. I had a wonderful career in the Air Force. And then I got hired by WKY Television in Oklahoma City, which was a prime NBC affiliate. And Terry, in those days, the networks did not have bureaus like they do now. So they just depended on professional stations across the country to cover news that was interesting to the network in that particular region. So it ended up where I was doing a lot of reports to the network shows, everything from, presidents visiting and forest fires and oil well fires and things like that. So I was getting on the network quite a bit from Oklahoma
And how did
City.
you end up in Cleveland?
Well, out of the blue, I got a call one day, completely unexpected, from NBC News, and they offered me the job to be the main anchor at WKY Television, TV3 here in Cleveland. So I came and took that job and had a great time there. And then I've been in Cleveland ever since, except for 5 years when I went to Atlanta to get into management for the first time. Other than that, then I came back to Cleveland. I've been here ever since, and this is home. I never want to leave.
Yeah, because it's an interesting thing. You would, you could have retired to Florida or Arizona or these places that people go. Why here?
Well, it's home. My family is here, and I've got children and grandchildren, and I get to participate in a lot of family events and birthdays and baptisms, and I've got 2 great grandchildren now, and I've got a lot of friends here and a lot of contacts, and it's home.
What was it? Did you ever have a moment on TV when you were afraid?
When I was afraid?
Yeah. Like really nervous to the point of, well, I might not be able to get this out or handle this right.
Well, there was a time when when I was in college, and I was studying journalism, and I was working my way through college at a radio station at Tulsa. I went to the University of Tulsa. And, when I got to the point where I was graduating, I had a little doubt. So I talked to my dad about it, and he said, what are you worried about? And I said, well, Dad, I said, what I'm worried about is, gee, there are a lot of really talented people in this business. And to tell you the truth, I don't know whether I'm going to be good enough to be a success or not. And then he said to me in Italian, but I'll say it in American, he said, destiny is your fortune and fortune is your destiny. And I said, Dad, what does that mean? And he said, it means that I believe that God sets a path for everybody who's born, and you're going to walk that path. He says, you're not going to be able to avoid walking the path. And if the path leads you to success in broadcasting, then that's what will happen. And if the path leads you somewhere else, he said, that's where you'll be successful and happy. So that kind of was like the foundation for me, and everything that's happened to me when I finally went into television. I felt like that it was my destiny to be in the business, and so that faith, and then I have a great deal of faith in God, and I've relied on Him on my moments when things have not been so well, professionally and personally, and I've always gotten through it because of that.
If someone were to come to you and say, boy, I've been retired for a while and I just kind of feel the age crushing upon me and I'm not sure, I have much value anymore, that kind of sort of depression that sometimes comes with that stage of life, what would you tell them?
Well, you can't convince anybody to do anything unless they really want to do it. So I would never try to convince them to do something they don't want to do. I mean, I have older friends who are perfectly content to sit around all day and read the newspaper and watch television, and that's their choice, and that's okay with me. But that's not for me. I have to be involved. I don't want to be bored. I still have this great need to be useful and to be part of the community and to feel like, gosh, I'm still participating in life. I'm still participating in the events of the community and the world. And so if they want to look to me for an example, then, that's their choice. But I certainly don't feel like I have the right to tell them what to do. It's an individual decision.
Right, Virgil, I think it's great advice, and because isolation is a really, it's almost to your peril, and it's easy to isolate as you get older. And also, I think sometimes, even no matter what age it is, what you just said there, somebody needs to challenge us. Well, what do you really want to do at this point? What do you want? Because a lot of times we haven't even thought about it, or I just need to get through the day. Well, there's a little bit more than that picking up the prescription. So, Virgil, I thank you so much. I think you could be a great role model for all of us. And thank you for taking time to share with us.
Well, God bless you, Terry, and thanks for letting me do this. And God bless everyone who's listening in. Thank you.
That was awesome and absolutely inspirational. Thank you, Virgil. And of course, thank you, Terry, for that great conversation. Now, before we say goodbye, I want to figure out who won the $250 gift card. Let's get in the chat here and see. Oh, there it is. Lori Sagardia is the winner of the Amazon gift card. Lori, our team will get a hold of you and make sure that you get that gift card. So a huge thank you to all of you who joined us this evening. I want to give another huge thank you to our sponsors, Medical Mutual and the Ohio Department of Insurance, and of course, to all of our speakers giving us this amazing information. That's a wrap, my friends. Have an absolutely wonderful evening. We will talk again soon. Take care. Thank you.